Hello, I will be demonstrating how to take blood pressure. First, you will have the patient sit down with their back straight and up against the back of the chair, with both of their feet flat on the floor. Next, you will place the patient's arm at heart level with their palm facing up on a flat surface. The patient must sit for 5 minutes before having their blood pressure taken, and the patient should not have any caffeine or nicotine at least 30 minutes prior to having their blood pressure taken. For proper cuff size, when the cuff is wrapped on the bare arm, it must close between the two labeled markers. If when wrapped, it falls below the first marker, a smaller cuff is needed, and if it closes beyond the second marker, a bigger cuff is needed. The prongs need to be placed in your ears facing away from you or the person that is taking the patient's blood pressure. You will place the diaphragm using your index and middle fingers on the brachial artery located on the pinky side of the arm, just below the biceps. First, roll up the patient's sleeves. Next, proceed to place the artery mark of the cuff on top of the brachial artery, as shown here. And make sure the cuff is tightly secured. You will tighten up the bulb by turning the valve to the right until it locks. Remember to place the diaphragm with your index and middle fingers right beneath the cuff. Make sure you have easy access and a clear view of the sphygmomanometer. You will pump up the cuff by squeezing the bulb up to 180 millimeters of mercury. Then you will proceed to release the pressure by turning the valve to the left at a rate of 2 to 5 millimeters of mercury per second. During this time, you will hear some thumping or tapping sounds, the first being the systolic blood pressure. Then the sounds will get softer until the last sound is heard, which is the diastolic blood pressure. These were the steps taken to acquire a patient's blood pressure measurements. A patient is classified as normal if their systolic blood pressure is less than 120 millimeters of mercury and their diastolic is less than 80 millimeters of mercury. A patient is prehypertensive with a systolic blood pressure between 120 and 139 or a diastolic between 80 and 89. Stage 1 hypertension has systolic between 140 and 159 or diastolic between 90 and 99. Stage 2 hypertension has systolic greater than or equal to 160 or diastolic greater than or equal to 100.